Hello, my name is Puran. I'm a clinical counselor and psychotherapist, and I have been doing family therapy for many years. The individuals and families I have seen suffering from depression and anxiety often describe their situations in how the relational problems around them in the family, how the relational challenges with the bigger societies, and also the political, historical concept of what has happened to them in the background. They are all important factors that I pay attention to. I want to say that depression is not a is not a single issues that people are going through it. Depression is about the conditions that surrounding us, the multiple factors that impact our mental health. If we are coming from the challenges of war, oppression, and systematic violence against us, of course, there are times that we feel depressed, sad, low, down, helpless, hopeless. And let's talk about the idea of how we are dealing with these conditions, mental health conditions. Often we have to pretend we are doing okay, and we are using all the coping strategies that we have access to, and to kind of survive the challenges. Yet, unless and until the systems around us do not get better, we feel the same. It's important that to kind of contextualize, we understand the context in which our mental health is important and our mental health gets impacted. I mean, let's talk about us Iranian, honestly, and people coming from Afghanistan, the same, people coming from many other countries, the same. Let's talk about how the system has influenced people's mental health for all these years. The sense of threat every day, and the violence against people, and the lack of safety and security for people. Of course you get depressed. Of course we get helpless. And you know what? The definitions in the Diagnostic Statistic Manual, the DSM, the book that psychiatrists and psychologists use in this Western world to understand the symptoms and diagnosis. I mean, that doesn't do the justice. You know what? Because according to the DSM, if you're feeling low and sad and depressed for about 2 weeks, then and there are other questions. If you're having lost the joy over previously enjoyed activities, and if you're not able to communicate healthy with your surrounding, and you're not participating in social activities, these are the definitions for or factors helping the clinicians to kind of make a diagnosis. However, those diagnoses do not do the justice, because we cannot forget and underestimate the impact of socio-cultural, political, and systematic violence that we have witnessed, and we have gone through, or we have been around. And still today, we are seeing all these situations. So these are factors that are challenging our mental health. And that's why once we are getting into the mood of asking for support and help, I'm hoping that the clinician would not only look at the clinical factors, being able to see the system that you and your mental health and your personal, family, and communities interpersonal health has been challenged. Therefore, for developing a great treatment plan according to individual's needs, we have to look at the surrounding, the conditions, the factors, and the cultural factors enabling or disabling one person to feel healthier, and taking care of those negative beliefs that depression is about, the negative beliefs about how one is disabled or unable, or not being seen as important, and disabled and unable in terms of changing their conditions. And so these are important factors. And if you are a counselor, social worker, mental health worker, anywhere in this world, you need to kind of look into those factors, the surrounding factors and external factors that are impacting the person's already internalized sense of loneliness, sadness, depression, and helplessness and hopelessness. So for making a proper treatment for the person, we need to understand what's going on in their families, what kind of separations, dislocations, and challenges has happened, and interpersonal conflicts. And by resolving them, looking at the system, we can help the person much better to kind of destigmatize themselves, and kind of understand that there is help available. Take care.